Well, good afternoon, everyone. I'm flying solo this evening. I wanted to give my ministerial colleagues a break after what has been a really busy week for them all. I would like to give you the most recent testing figures for today. Total tests undertaken, 1,403. Awaiting results, 160. Number of tests sent today, 70. Total concluded tests, 1,243, which means today we got 96 back. Total confirmed cases, 114, which is an increase of 19 on this time yesterday. Total confirmed new cases since this morning's update, 0. Number of current hospital admissions, 4. There has been an increase in confirmed cases, and I know this may have caused some concerns. Some of this is because of the high level of testing we have been doing. We are testing a lot. I provided some figures in my briefing yesterday. This is not an easy job, and I am grateful to our teams who are doing it. We have the equipment we need to do the testing. The laboratories in the United Kingdom are turning our results around still within about 48 hours. By the middle of this month, we will have our own testing facilities up and running. Some people have asked me whether the increase in positive tests means that the measures that we have brought in are not effective. Now, I understand why people might think this, and I think it is worth clarifying. Much is still unknown about the virus, but we do know that the incubation period can be long. The clinical advice is that it can be as long as 14 days. You can have the virus for this long time without showing symptoms, but during this time you could be infectious to others and spread the virus. Before the virus was spreading on the island as we went about our business, the measures in place enable us to suppress the spread of the virus, to isolate it. We need to see it to fight it. This period of 21 days will help us get a clearer picture of the scale of the challenge ahead. Please remember, COVID-19 spreads through person-to-person contact. Reducing person-to-person contact will reduce the spread. If we reduce the spread, we reduce the risk to our community. It's quite simple, really, isn't it? By staying at home, you are breaking the chain. You are preventing the transmission from one household to another. And please don't forget, it is not just about you passing the virus on to someone else. By staying at home, you may be preventing someone giving the virus to you and your loved ones. I thought this was an important message to share with you in advance of what looks like being a sunny weekend. It was a week ago that we closed our borders. I made a statement in Tynwald this morning to remind people why we had done this. Since that 1 week ago, the world has changed. 1 week ago, the World Health Organization was reporting that global confirmed cases were approaching 500,000 and over 20,000 confirmed deaths. Well, these figures have doubled. Globally, there have now been 1 million confirmed cases and already 45,000 deaths. Even just 1 week ago. I wonder how many of us could have predicted where we would be today. We were all seeing tragic images from places we may have been on holiday. Even before the UK, we were seeing the people of Italy and Spain experiencing deeply distressing situations. And over the last week, our island has changed. On Wednesday this week, I stood before you to share the sad news of our first COVID-related death. Life has fast become very different. We need to redouble our determination. In a second, I will take questions. I also want to share with you a new video clip. Before I do, I would like to say something about the announcement I made in Tynwald today about work to enable some of our residents who are stuck overseas. Some people have said we forgot or abandoned our residents. Nothing could be further from the truth. We have made clear that we wanted to find a way for them to come home. but our clinicians told us that closing the borders was the right thing to do. They also told us that if we reopened them, even to let in our own, we would be importing danger to our island and putting lives at risk. We listened to their advice. We found ourselves between a rock and a hard place. We wanted our residents at home, but we were not prepared to put the lives of our community on the line. We have continued trying to find a way through this. We have a plan. We are close to finalising the protocols that may enable the return of our residents in a managed, safe, staggered manner. We will be working to finalise the detail over the weekend and will make a full announcement on Monday. This may not solve every person's immediate issues, and we will not be throwing open our borders. It will involve small batches of people and rigorous enforced quarantine. Please rest assured we will only act in a way that our clinicians fully support. More on Monday. So before questions, I would like to give some shout-outs. As always, there have been too many to mention them, but today's three are: first, one of our low-income workers yesterday returned a £400 tax credit because he felt there would be people in more need of it than him, and we should just pay it back into government funds. Second, a team shout out to Noble's laundry and linen staff. Someone wrote to me about how hard they are working behind the scenes in support of the medical staff at the hospital. A big thank you to them. Third is thanks to Fenaudery, who have adapted their production line in making World Health Organization standard hand sanitizer, maybe with a hint of juniper. This week they donated 500 litres to the Department of Health and Social Care. Manx spirit in action. Thank you to all of these and everyone else who was going above and beyond. Please keep your praise coming. I will now take questions. And first we have is Rob from 3FM. Rob.
Good afternoon, Chief Minister. My first question is just revisiting something just for a bit of clarity, really. In terms of if someone has gone through the quarantine period and may be considered to have defeated the virus, what tests do these people undergo to make sure that the virus has left their system and that they're able to come out of self-isolation safely?
Well, all people will get advice from our public health department. They do all the tracing. They speak to the people who have the illness, who are self-quarantining, and I believe they are being contacted very briefly every day once we know you've got it, to see how they are, and they will be advised by our team when they can safely go back into the community.
Thank you. My second question, we've seen again from the police today, they've reported in the last 2 to 3 days now more potential incidents of breaches of social distancing rules and self-isolation rules. Now, the likes of government, emergency services and other members of the public are saying it until they're blue in the face to follow these rules, but it seems a small minority it just doesn't seem to be getting through to, and those could have vast effects for the much bigger majority of the island, as we know. So if this continues, what are the sort of measures that would have to be implemented again going forward?
Well, in House of Keys and Legislative Council are currently meeting. We've introduced a £250, up to £250 on the spot fine for that the police can give out to people who are making these sort of breaches. Obviously, the more serious, up to £10,000 fine and 3 months in prison, or a combination of both, are still there for the more serious breaches of breaching your isolation from your house if you're diagnosed and have been told to stay at home for 14 days. So the serious offence is still there, but we're bringing in an additional one. Obviously, the legislation is going through the Legislative Council as we speak, but I hope that by the end of today that will be fully operational and that will give the police the powers to make the on-the-spot fine straight away. So, yes, we are ramping up the action. The Chief Constable does tell me that on the whole, there has been a high level of compliance, but sadly there is always a very small minority who ruin it for everyone, and we will we will get them. We will take action. We don't want to take action. We hope they will be sensible. But my post bag or my email bag and Facebook bag, etc., is full of pictures of groups of people breaking that, and we will go after you. So please, but it's just incomprehensible to me when so many people are following the rules and regulations for the sake of all, that a few ignorant people are breaking it, and that's why we've brought in these extra regulations. So we don't want to have to go through this fining process, but we will. Thank you very much. We move on to Mr. Moulton from MTTV. Paul.
Mr. Quayle, Howard, thank you very much. The day that NHS Nightingale opens in London, I want to know how we're doing here, because the trajectory is going up. Now 4 people are in Nobles Hospital. We clearly will be heading possibly that way anyway on the curve. The Health Minister, after asking a few times now about the NSC and what is going to happen there, basically I'm asking, is there going to be somewhere that you're preparing to make as the overspill, and where will you get the staff, where will you get the equipment, where will you get the beds, etc.?
Right, well, obviously, we've looked long and hard at this, and it's been decided that we will provide extra facilities in the grounds at Nobles Hospital. So Ward 20, the old Newlands ward, for those of that you know, it is being kitted out specially for this. Certain rooms which have been storage are being converted. So we have significantly worked to increase the number of beds that we have to enable us to counter the obvious extra increase in demand. Obviously, we've got wards 1 and 2 already put aside. We've moved an awful lot of treatments from Nobles Hospital for minor issues at A&E down to Ramsey District Cottage Hospital, and our medics feel that the best way to treat the increase in demand is to have it under the auspices of Nobles Hospital. Instead of splitting our staff into 2 and maybe putting them elsewhere, we are only a small island, let's keep them up at Nobles Hospital but provide additional beds and additional facilities. And I think it's key to point out it is about having staff trained, and we've been upskilling our staff on how to deal with using ventilators, for example. We only had 6 at one stage, we're now up to 14 that are ready, but it's all about the staffing. And it's okay countries saying they're going to buy an extra 20, 40,000 ventilators. You've got to have the staff to be able to operate them, otherwise they might as well be in a box. Equally, where we see the key problem, it won't be so much the ventilators, it'll be the level down from that, where people will just need oxygen maybe through the nose to, I think it's called EPAC, and that's an area that we're working on to significantly increase our capacity. So lots of plans. We have been working on this for a while, and that's a real credit to all our teams in the Department of Health and Social Care who've been working on this. Your next question, Paul.
Yeah, this one's come from many sources over the weeks, and it's come up again. So let me read this out. With thousands of private sector workers being asked to live on £280 a week, less deductions in the wage support scheme, our government looking to put those public sector workers who are no longer working and are not essential on the same package? And are we not all in this together?
Well, we are all in this together. I think I gave a talk about this, 2-3 days ago, where I pointed out that we had people from public transport up at the the mobile testing centre, shepherding the cars that were coming in for the mobile testing. That's still going on. The 111 line, where it's not medics, it's civil servants operating, taking all the phone calls. The 862-262 telephone number, that is being manned fully by civil servants who've been redeployed from other departments where their job has been put on hold for the time being. So what we're finding, and those are just examples, I hasten to add, they're not the only 3 things where it's happening. So we are redeploying our people that work for government in other areas to help out. So I hope that answers the questions, Paul. But I understand that, and that's why we have put such a big package together, costing just under 100 million, I'm led to believe, for the 12-week period, to help support people who have been laid off or sent home with no work to carry out. Next, I think we have is Tim Glover at Manx Radio. Tim.
Pastor Chief Minister, hope you're well.
Yeah, I'm fine. Thanks very much.
I sent an email through earlier to be brought to your attention. It was from a very concerned staff member at a large corporate business on the island, which has 2 site offices. Now, a staff member at Site A tested positive for COVID-19 yesterday. The team around the case at Site A was sent to Site B, while Site A was cleaned. Bosses were prepared to make this move without informing staff at Site B. This appears to be a case that's been put to me, and I've had several concerned staff members get in touch where bosses appear to be putting the business ahead of lives, putting lives second. Be interested, and it makes a mockery, obviously, of your contact tracing that government's engaging in. Be interested in your comments on this, Chief Minister, because it's a worrying one.
Well, it is really worrying, Tim, to hear that this is going on. And if that's correct, then I would urge the staff to ring our telephone number down at the sea terminal, which is 686 262. Raise that concern with them, and our team there will report that business to the Department for Enterprise, and staff officers at the Department of Enterprise will go out and take action against any business that is breaching the rules. We expect all businesses to put their staff first. Yes, business has to go on where possible, but all the self-isolation, the 2 metre, 6 foot rules and regulations, hand washing, etc., should be clearly followed. And if there's a clear breach, then please ring, because that should not be happening.
And I just want to return to the issue that Rob from 3FM raised regarding the police. They got slated in the early days for being too heavy-handed. Now they're being criticised for not responding to reports of social gatherings in houses. They can't really win in this situation, but they have put that warning out. And just wondering if a really firm example of a company or a social gathering being really clamped down on will really help send the message out there. And is that not being done because you're still getting the powers into place and that the courts are largely closed as well?
Well, it's not about the courts not being closed. There has been a high level of compliance here, Tim. However, we know there have been some silly instances that need jumping on, and that's why today we've brought through the legislation in the House of Keys. We've obviously had a Timble sitting, then I had to have a House of Keys sitting where we implemented the first, second and third reading. It's gone off to the Legislative Council, and that will enable the police to do on-the-spot fines of up to £250 for people breaking it. Now, there might be a few minor tweaks, I hope anyway, from the Legislative Council. I can't presume what they're going to say about the legislation, but the House of Keys did back it strongly. So once we've had that approved in the Legislative Council, the House of Keys, if Legislative Council have made some tweaks, will sit again, hopefully today, and then that will be the law there. The powers are there for the police to do the on-the-spot fines. But if the police feel that people are blatantly breaking the rules, they can still go after them, the people now, for the more draconian up to £10,000 and 3 months in prison. Obviously, I can't comment on court cases, etc. at the moment. That's between the police and the courts and the people involved. But I know, because we're having a sunny weekend, and that's great, that we could have problems, and the police have committed to being out there with a high profile to stop this from happening. But I do have a sympathy for the police. Today I was criticised by one MHK for not shutting the borders 2 weeks, having been constantly criticised by a raft of backbenchers for not allowing for closing the borders. So I'm in the same position where I'm criticised each way, and I know the police. I know I've had complaints that the police, how dare the police stop people, but I see them, that's doing their job, and you should be reassured that if the police are stopping the occasional person in their car just to see that they're being responsible, that their journey is really necessary, then that should, to me, that's a reassurance that our police are taking this seriously, and they're making sure that the people of the Isle of Man that are out and about are taking it seriously too. And I'm just there to give my support to all of our services out there that are trying to uphold the law and make this a safer place for everyone. Thank you very much. Thanks very much, Tim. We've got Alex next from BBC. Alex.
Hello, Chief Minister. I'd just like to build on a point that Tim Glover raised there, please, and it specifically concerns public workers, so the likes of teachers, bus drivers, postal workers. These are people who, despite changing their workplace practices, I'm sure can't stay at home. They can't avoid contact with many members of the public on a daily basis. So are they being tested as a priority? And does the government compile a number of public workers who may have tested positive?
Right. Well, I think that there is some confusion, Alex, over when you say, are they being tested? If they put forward if they show signs of the illness, whether that be a sore throat, temperature, and they decide to stay at home, they will be tested like all members of the public, because we did not stop testing on the Isle of Man, unlike the United Kingdom. So there seems to be a confusion. If you test too soon, they could pass that test and be given the green light to carry on, and they then show symptoms at a later date. Now, there is another test which we're all hearing about, and there are 9 companies that have come forward saying that we can do this antigen test, which is doing the rounds at the moment. It's highly public. It's being highly publicised out there. But at this moment in time, none of those tests are good enough to satisfy public health, and that's not just Isle of Man, that's the UK. And I think the Chief Medical Officer yesterday clearly stated that no test is better than a bad test. We need to make sure that when we do these antigen tests to see if people have had it and whether they've built up antibodies to it, we need to make sure that these tests are reliable. And at the moment, I'm led to believe that none of the 9 have got the reliability up to an acceptable level. So we are testing everyone on the Isle of Man that has shown the signs based on medical advice from when they report in. And obviously the police force, the fire brigade, the ambulance service, all our people are being trained on protecting themselves and when they're out in the community, and how they approach members of the public. And obviously we will be inviting next week, actually, the Chief Constable will be coming in to give a talk about a number of issues, and I'm sure, I think it's middle of next week, if memory serves me correct. I'm sure you'll all look forward to having a chat with him and asking him all the questions that you have on that issue.
Absolutely. Yeah, just to drill down there, the second part of that question was really the important bit. Have any public workers, to your knowledge, tested positive? Because you will agree that if a public servant tests positive, they could in effect have been a super spreader.
Yeah, I mean, this is to the best of my knowledge. I've not been made aware. Obviously, we have some medics from Nobles Hospital who are in isolation, but at this moment in time, I'm not aware of any police officers. Some have isolated themselves, but I'm not aware of that. But that could be misleading information. I'm not aware of it. I don't get told who individually has this illness and what they do. So it's something I can find out. I'm sure the Chief Constable will be able to answer from his side of things from the police force going forward.
That would be helpful, thank you.
Okay, right, next we have Jess from Isle of Man Newspapers. Jess, how are you?
Good afternoon, Chief Minister, I'm good. So I'm actually wanting to draw upon some of Alex's points. What is happening in terms of supplying PPE to other key workers, so people working in supermarkets, caregivers who are working with at-risk people, and teachers looking after key workers' children?
Right, well, there's been different criteria set up for different people by Dr. Hewitt and the public health team on when you should wear the equipment and the different levels and the different risk levels that you take, obviously from a nurse going into a ward like 1 and 2 and having to deal with a patient in isolation who has maybe been confirmed as having the case, down to working in the rest of the hospital or in the community. I don't have that personal information myself, but I know that training has been given to managers of all different groups of people throughout the community and what they wear and need to wear and the different situation. I know, for example, I think 27 pallets of equipment was picked up yesterday from Liverpool and brought over to the island, and that was full of equipment. So we do have a good supply of PPE equipment. Obviously, we cannot allow everyone to have the stuff that they don't need. Some of the equipment is for the masks, etc. It's in high demand, and we can't have it being used where it's not necessarily needed to. And that's not my call as a politician. That's the call of our clinicians, and they give the advice on how it should be used. So if anyone has a concern, then I would urge them to ring not our 111 line, because that is for clinical emergencies, but the 686-262 number if anyone has a concern that maybe they haven't got the right equipment needed for their job. But I would be disappointed to hear that, because managers throughout the island in charge of staff providing these sort of services have been trained and communicated. I think the health minister stated this yesterday in this briefing, have been contacted to on how their staff should be dealing with the situation and their personal protection.
Okay. My other question is, so what is the general care plan for those who have tested positive for coronavirus and are having to self-isolate?
Well, really, I suppose it's dependent on the individual case. Now, the vast majority of people who have it are self-isolating at home. And I know once you've been told that you've got it, we then ring up every day, very briefly from Public Health, just to see how you are. They will ask a number of questions, I'm sure, to try and decide for themselves whether you need to come into hospital or whether you need to be inspected, checked out to make sure that it is safe. So as I think we've said time and time again, about 90% of people, this will be less than a minor cold. But the remaining 10% we need to monitor carefully. So I think the answer is Public Health do contact people every day who've been told they've got the illness, even if it's just briefly, just to see that they're okay and make sure that their symptoms haven't deteriorated since they were last spoken to. And obviously we have vulnerable people living in the community. If they've got it, then we can have personal visits to them if that's needed. So that again is a medical decision, clinician decision on how we should be treating people who come forward with the disease and are told they've got the disease. Okay, thank you,
Brilliant.
Jess.
Thank you.
Chris from Energy FM. Chris.
Good afternoon, Chief Minister.
Hi, Chris.
Since the borders have been closed to those coming into the island, are you able to tell us how many people have managed to obtain special permits and what jobs they're being brought here to do?
Right, I haven't got the numbers. Some of the permits will be obviously for the medical side of things, and I think that's been the key area at this moment in time. The numbers are low; they're not a big number. We've obviously got these measures in place to allow people to come and maintain the power station. If a specialist part breaks on the gas turbines, then obviously we might need to bring someone over to fix it. But these are not big numbers. We have allowed exemptions for companies, which has caused a little bit of concern in Tynwald. But the logistics of the plane flying over with the mail, for example, those people don't sometimes get off the plane. Technically, they've landed on the island. So we say, right, anyone flying with that company, as long as they follow the rules and regulations, that company can give them that exemption. Same with steam packet employees on the crew on the ship coming backwards and forwards. They're not going to be wandering around the island, but they have a company exemption so that we're not having to file individuals. So it's low numbers. I will try and ensure that we have that figure for you on Monday, but it's not a figure I've had chance to get to the bottom of at this moment in time. And your second question,
people in the UK are still being encouraged to go to blood banks and give blood during this pandemic. What is the situation like here? Do we have the infrastructure to carry this out while the current social distancing rules are in force?
Well, obviously giving blood is incredibly important. Now, I haven't been advised to the different on that one. So the advice in the UK is something that we normally follow. If I'm advised differently after this briefing, I will, of course, put out a announcement, but the advice will be business as usual. But obviously, if you have issues, if you're displaying a temperature, a constant cough, a little bit of common sense, don't go anywhere near the hospitals, etc. But I should imagine blood testing is business as usual. But obviously, I'm flying solo today. I don't have the health minister with me to give his more knowledgeable advice on that area. But if we take it that blood clinics are still going ahead, if they're not, I will advise. Thank you very much, Chris. And we move on to Josh from ITV. Josh.
Thank you, Chief Minister. My first question, there has been some speculation about different ferry crews travelling to and from the Isle of Man on the Ben Macrae from the UK, bringing freight across. Can you just explain exactly whether UK crews do come over? Do they then stay here? And what's the procedure in place for ferry crews, and how are they being protected when they're here?
Well, for the vast majority of people, Josh, on the crew, they don't get off the ship. You'll be seeing a video shortly where freight is taken off by our people. They go in and unload it, and then it's been delivered by our Manx companies drivers to the various depots around and shops around the Isle of Man. So there are only a small number of people who will physically drive off the specialist, maybe the oxygen wagon as an example, and there are certain protocols for them to follow, and then they're straight back on the boat. So people who are on these cruises cannot just wander around the island. They have to comply with a set of rules and regulations that the steam packet, the plane from the post, etc., experience. If any plane crews stay overnight, they have to stay at a certain hotel just across from the airport, and then they're back straight away, keeping those isolation distances, etc. So if anyone knows anything to the different, then of course we would be interested, but there has to be an element of trust, and that's what I see. We have these key workers. We've got to have the boat coming every day with supplies of all our food, and we just hope that the steam packet staff, and I'm sure they are being sensible about this for all of our protection. I'm more concerned about events. I know the other weekend it was a nice day, and I was hearing Peel Promenade was full of people walking. We're going to have a hot weekend, folks, and I really, really ask you to think long and hard about, when you go out, where you're going to go, and try and keep away from people if possible, but make sure you do your 6 foot 2 metre isolation from people when you walk past them. That's how the spread will continue if you're not sensible. And I've tried to put in this speech today how much things have moved on just in 1 week. The number of deaths in the United Kingdom a day is the same as it had been a week ago, with all the fortnight added up, if you see where I'm coming from. They're now losing over 500 lives a day at this moment in time. A week ago, that was their total, was 500 and something. This has moved on, and I hope people are taking this really seriously. So yes, a beautiful, hot, sunny Manx weekend coming, but please be careful and really think about when you go out, where you go, and please keep your social distancing.
My second question, how much contact does your team have with the Manx residents that are stuck overseas? Again, today I've spoken to people who have no family where they are. They're desperately awaiting contact, or some waiting for replies from the government, and some are in temporary accommodation and therefore need some sort of time scale because they can't stay in that place forever. So is this plan that you're due to announce something that will be announced next week, and then there'll be a few more weeks before it's implemented, or is there a sense of urgency now to bring those people home?
Right, well, we'll be announcing the plan on Monday. It's not going to be a mass, I'm not saying a mass group of people coming back. It will be in a staged manner, in small numbers, so that we can control it. They will have to go into isolation, etc. And we will be announcing all the detail on Monday. But obviously we will be prioritising people from health issues to vulnerability to age groups when we bring them back. This plan is being worked on by the medics at the moment, and that's, it will be as soon as we possibly can, but it must be done to ensure the safety of all of the people on the Isle of Man, that we don't bring back large numbers at once. So I hope that gives you as much information as I can give, Josh. Obviously we are working flat out. We'll be all back in tomorrow and Sunday working to ensure that we have a plan ready to go on Monday to announce to you all.
Thank you.
Okay, thank you very much. Now, I know how moving you found the video clip featuring our health and social care colleagues last week. So before I go, I would like to share with you a new video that pays tribute to the vast range of people who are keeping our island moving during these difficult times. Until the next time, please have a good weekend, but please do it at home wherever possible, and please stay safe. Thank you.